I'm Corey. I am the Acting Director of Nursing for the Winton Multipurpose Health Service. So here in Winton we have 8 acute medical beds. So when patients are admitted into our 2 resus beds behind us, they will be admitted if required into the acute ward, and we have 6 aged care residential beds. So we do have a great team. So we have a mixed nursing team here of all streams. So we have clinical nurses, registered nurses, ENs and AINs that work on the floor across all departments. So everyone is working at the top of their practice for healthcare in Winton. So I've been a nurse for 12 years, I think, and I first came to Winton in 2018 for a few months, just a short contract. I have friends in the area, so that's what brought me out originally. I came back this time for a 6-month secondment and loved it. So I've stayed and I've converted to permanent CN, and I'm acting up in higher duties at the moment while our Don's away. There is a great opportunity to expand our scope and act up in these higher roles. This acting up in this higher role is probably the biggest example. So I've skipped from CN to an acting Don position, which you would never see in a metro area. The community is very accepting of healthcare people when they come to Winton. Obviously we're providing a great service for the community, so they do welcome us with open arms if people were to come here for work. People will know who you are before you know who they are. I went to buy a coffee on my second day of being in town and people knew who I was before I had even introduced myself. And there's lots of community events and engagement going on. So there's like local sporting teams that people can join, and there's lots of tourist events that go on over the winter, and in the cooler months we see lots of tourism and lots of fun events go on in that time. So obviously all the staff, when we're not working our shifts, can obviously involve ourselves in those community events. I love to swim, and I have a small sausage dog, so I walk the dog and swimming at the pool, and also a dinner at the Tats never goes astray. That's also fun. It's a very long way from home. I'm from Kingaroy, which is near Toowoomba, so it is a long way home. And all my friends have sort of migrated to Brisbane, so the biggest challenge is probably isolation. But obviously now, with the blessings of COVID, we have Teams meetings, and we have iPhones, and we have FaceTime, and we have a flight that goes directly to Brisbane from Longreach, so a bit of a drive to Longreach and then onto the plane to Brisbane, so it's easy to get away for a little break. Team players, that's what we look for. So fun personalities that are team players. Obviously we work across all of the specialties here that we provide in Winton. So that ranges from aged care to triage and emergency. So we like people who come with a go-getter attitude and like to work across everything and give anything a go.